After a fundoplication operation, some patients do experience some difficulty in swallowing and difficulty to belch. So this is a very common thing what we see. This is because when we do a fundoplication, we are going to wrap the stomach, the fundus part of the stomach, around the lower esophagus in the GE junction. So this will act as a valve and it prevents stomach contents from coming into the esophagus. The main reason to do this operation is to prevent the reflux. Patients who are having acid reflux, they have a defective valve mechanism. The anti-reflux mechanism is gone, it is not working. The anti-reflux mechanism includes the angle of the intra-abdominal length of the esophagus. That is, at least 2 to 3 centimeters of the esophagus should be intra-abdominal. The tight crus, the diaphragmatic hiatus should be tight and snug, and also the lower esophageal sphincter. The main anti-reflux mechanism is the lower esophageal sphincter. That should be competent, and the esophageal clearance mechanism. If all these things are fine, then the reflux is not going to happen. So a defective anti-reflux mechanism leads to GERD, that is gastroesophageal reflux. Some people have very occasional reflux, some people have very frequent reflux, some patients do develop complications. So when you have a hiatus hernia, you have an incompetent lower esophageal sphincter, a loose hiatus, loss of angle of or poor esophageal clearance, all these things contribute to GERD. So in anti-reflux procedure, that is a Nissen's fundoplication, which is a time-tested procedure. It is there since many decades and it is one of the most commonly performed operation for reflux. In this operation, the entire disturbed or distorted anti-reflux mechanism is restored. We are going to tighten the diaphragmatic hiatus. So we are going to restore the intra-abdominal length and do a wrap. We are going to restore the valve mechanism. All these things contribute to a competent or a functional anti-reflux mechanism. So as you all know, a valve will allow unidirectional flow. So it prevents a bidirectional flow. So when we restore the valve, there will be flow only one side from top to down. So it prevents the reflux, that is from food contents from the stomach and the acid content from the stomach going into the esophagus. A valve mechanism only allows a unidirectional flow. It will prevent the bidirectional, that reflux is prevented by the valve mechanism, the anti-reflux mechanism. This is what is restored in the Nissen's fundoplication. So when we do this, some patients do experience difficulty in swallowing and belching for few days after the operation. This is fairly common in patients who undergo surgery. There is a Nissen's fundoplication. Most of them will overcome this. This is going to settle down in few days to few weeks after the operation, sometimes slightly longer. So no need to panic, no need to get worried. So this is one of the best procedures, time-tested procedures for acid reflux. When we make this wrap, there is some feeling of dysphagia or discomfort when you swallow food. It feels as if it's getting stuck here. So not only that, belching becomes difficult. So the surgeon takes all precautions to see that it is not very tight. Generally we do a very short and floppy fundoplication. So we check that it is not tight. Despite that, some patients experience some difficulty while they swallow. So most patients are very much worried about this when they come for follow-up. This is not going to last long. Most of the patients will overcome this in few days to few weeks time. So with time, what will happen, you will be able to swallow normally and belch normally. Need not worry about this post-operative discomfort in swallowing. It is going to settle down in almost all patients, irrespective of what kind of wrap you are doing. This is not going to be a permanent thing. This is going to settle down in few days to few weeks time. My name is Dr. Dattaram. I am a senior consultant surgical gastroenterologist and a laparoscopic surgeon. I have been performing fundoplications for more than 2 decades now and have done thousands of these operations, and they have a wonderful outcome. This is one of the best surgical procedures which corrects the entire altered anatomy in a patient with acid reflux. We tighten the hiatus, we are going to do a crural repair, and we are going to do a fundal wrap, that is a fundoplication, and also restore the intra-abdominal length of the esophagus. All these things prevent acid reflux. We are going to restore the anti-reflux mechanism. This is the best procedure to completely eliminate the reflux. My name is Dr. Dattaram. I am a senior consultant surgical gastroenterologist and laparoscopic surgeon. I practice in Hyderabad. To consult me, you can call or send a WhatsApp message on 98954 37059. If you like this content, please like, share, subscribe and comment. And thank you so much.